Hello, everyone. I want to welcome you to Open Therapy. Open Therapy is a monthly free online seminar where we discuss everything mental health. Talking to us today is Dr. Paul Kumi, a clinical psychologist who specializes in trauma. So, Dr. Paul, over to you.
Thank you all very much for making time for July's edition of Open Therapy. Basically, we would want to know how to take advantage of the 45 minutes or 1 hour therapy sessions that we may want to, register for. So basically, that's what we'll be doing today. And today's conversation will also it's going to feed into what we did last month. So just for the benefit of those who couldn't join last month. So largely, we spoke about how transformative therapy can be, and then we spoke about a couple of things that therapy could do for us. So mostly it had to do with it giving us access into the hidden parts of ourselves that we haven't been able to access, and then also give us insight into how to handle some difficult situations in our lives, and then also helps us to get a diagnosis as to what is going on with us so that we can have some clarity and empower ourselves in terms of gathering the necessary information that will help us navigate our lives in spite of whatever our mental health state is or has been. So that's just a little background. As we progress, I'll talk a little about the transformative part of therapy as we go along today's topic. So I'm happy that we are all here. I hope we have a good time of learning. Today, we are talking about how to maximize our therapy sessions. So those of us who have never been in therapy, we wonder, sometimes we wonder, like, this whole therapy thing, what's it about? People sometimes ask those kinds of questions. What's therapy about? Are you just going to sit in front of someone and talk to the person about what in particular? So sometimes we are a bit apprehensive about what therapy is and what comes with it. And so today that's what we want to delve into. There's a data here that maybe we could all read to acquaint ourselves a bit with present data. Unfortunately, we don't have any local data to compare or to contrast this with. But then in my practice, I've seen a couple of things. So maybe I may be able to give some data without necessarily it being generalizable. So 1 in 5 of adults in the US suffer from some form of mental health disorder. That means that if you take 10 people, two of them, or if you take 5 people, one of them may have some form of mental health disorder. Now, there's a difference between a mental health disorder and then some form of mental health struggles. So a disorder is pervasive. When you say something is pervasive, it means that it's long standing, it's been going on for a while. And then it also meets a certain criteria that clinicians have to determine what is going on with a person. So that's what qualifies for a disorder. But we could sometimes have some mental health challenges from time to time, which may not necessarily qualify to be called disorders. So this data, basically it's saying that for those who have received a diagnosis, okay, those who have been diagnosed, it's 1/5 of the adults population. Mind you, my PhD work confirms this particular one because with my PhD, I also looked at adults, and I found something very similar to this. So, and again, this was done in Ghana, so it sort of confirms that there's something going on with each one of us. And over this period of work of years that I've been working, I've realized that it's everywhere. It's mental health challenges it's just a new germ. We just need to get acquainted with the fact that it's a new germ, and we need to try and work around it. We all experience some form of challenge that mental health from time to time. So that said, it will surprise you to know that typically where I work at University of Ghana Medical Center and then in private practice, sometimes it takes people 3 to 4 weeks to get an appointment. That's how scanty or difficult it is to get mental health care. And that's why we are doing what we are doing now. I mean, if I say scanty, I meant to say that's how scanty the number of professionals there are in the field. And so if you look at the second data, it says that more than half of them, I mean, about 55% of them never receive treatment. And it could be in two ways. It might be simply because access is difficult sometimes. And then on the other hand, we usually don't know how useful therapy will be to us. So, and then how to maximize it. So today we want to spend this quality time discussing how to maximize our mental health or our therapy sessions to enhance our mental health. So when you say therapy, what is therapy? In practice, one interesting thing is that when I started working at University of Ghana Medical Center, a doctor walked up to me and said, because I went to the ward to review a patient, the doctor was like, so you people, what do you do for these patients you come and see? So it's interesting. It's interesting to find that most of the time people do not even know what happens behind those doors. They and I want to give you a gist. I want to give you an idea what happens behind those doors. So if you look at the image right here on your screen, you'd see that I mean two females, they are sitting in a couch or sofa or something like that, and and so this is the picture people have in mind. Once I'm going for therapy, I'll be given a very nice chair, and there'll be some light in the background. Someone will be sitting in front of me holding a book, and then I have to talk, and stuff like that. So, well, that does happen, but that's not the full picture. So, when you say therapy, therapy is basically um, talk, talk, but it doesn't end with talk. So there are times that we do therapies that you do not necessarily require your patient to talk at all. That's something a lot of people don't know. There are also therapies that are purely procedural. So a patient comes in or a client comes in, and it's we just do take the client through some form of procedure. So maybe next month or in the coming month, we talk about some forms of therapy, and then some people have an idea what therapy is. So therapy is not just what you can see on your screens right now. That maybe um, you have a talk, or I mean you have a chair and someone sits in, and even in some of the movies, you would find people lying in a recliner chair, and somebody sitting behind them holding a book and stuff like that. It does happen sometimes, but that's really one picture that we see. So there are different forms of therapy, and these types of therapy will determine what is done. But like I said, fundamentally, if you take maybe if I want to just speculate, maybe between 0 and 10, 6% or 6 out of 10 of the time, it's what you are seeing. It's usually talk. And so for those who have never been in therapy, this is just a picture of how therapy could be. Um, a lot of people wonder. So the two things happen before people seek therapy, and sometimes in therapy, when people decide to show up for therapy, two things happen. And I'm using therapy um, as a generic word. So a lot of people will usually say, "I have nothing to say. I'm going to see this doctor or this therapist, counselor, mental health, whatever, and but I have nothing to say." So the point is that that's even more the more reason why it would be good for you to go for therapy, because on the most part, if you have nothing to say, your body will say something. The your eyes will say something, your face will say something. So you're actually saying something, but you may just not be using your voice. And as psychologists or therapists or counselors, depending on the training, one day we'll talk about that as well, like who is who. So who is a therapist, who is a psychologist, who is a counselor, who is a psychiatrist. One day we'll talk about that maybe in the future. But for the purpose of this conversation, um, you'd find that people come in without knowing what to say. It's just okay to come in without really knowing what to say. I've had moments where a client walks in and, you know, typically you're supposed to introduce yourself and then acknowledge the client's presence and stuff like that. So I do all of those things, and then um, the client just jumps in and says, "Hey, doc, I don't know what to say." Yeah, it's normal when you don't know what to say. It's absolutely normal. So don't shy away from therapy, even when you don't, even when you haven't figured out what to say. It's just okay. We are trained to read body language. We are trained to read or to glean some insight from facial expressions and tone of voice and pitch and stuff like that. So we can start a conversation without you necessarily trying to start the conversation. Again, there's a way we've been trained to navigate simple conversations. So sometimes you ask a patient, maybe tell me a bit about yourself, and they go like, "Oh, I don't know what to say. What do you want to know?" That's also normal. It's not offensive at all. We hear that all the time. So even when you have nothing to say, just show up, because once your clinician is skilled enough, they'll be able to pick a few things which will help you get into a very meaningful conversation. So there's that one challenge that prevents people from coming to therapy, or sometimes make people a bit apprehensive about being in therapy. Um, so the other one is that on the same point, the other one is that some people are on, they feel, they say something like, "There's nothing wrong with me." So, um, again, that's why people hesitate in therapy. They say there's nothing wrong with me, and for the most part, it's more about trying to prove to the therapist or to the psychologist that there's actually nothing wrong with them. That's also normal. We see that all the time. So regardless of how you feel, whether you have nothing to say, you don't know what to say, or you feel that this um, clinician, doctor, whoever it is going to find something wrong with me, and so you're a bit apprehensive, it's normal. What I would encourage you to do is to just show up. Just show up. If you have nothing to say, if you're apprehensive about the person thinking there's something wrong with you, don't worry about it. Just show up, because we are trained to handle those things. Let me say this before we move on to the next slide, which is that um, in one of the things we don't do as psychologists, therapists, and mental health counselors, and those in this fraternity, is that we don't ask people what's wrong with you. And even now in the medical field, the physicians and the surgeons are being trained not to ask patients what's wrong with you, because actually, if you are going to ask people what's wrong with them, we must be asking ourselves what's wrong with us, because there's something wrong with each of us at some point in time or another. We've been going through stuff. So that's why we are trained not to ask what's wrong with you. What we typically ask is what's happening to you, and in Gen Z parlance, like what's up, So so typically that's how the therapy is. Go in, have no, if you have apprehensions, it's normal. If you're a bit jittery, is normal. And don't worry too much about what you have to say or what you cannot say. And then also don't worry too much about how the therapist or the psychologist sees you. We've been trained to understand these things. So just go in with the intent of doing the next thing I'm going to talk about, which is go in and be willing to be transformed. Okay, so the next thing I'm going to talk about is have a transformative mindset. So therapy is very, very transformative. That's why we did last month's conversation, or we had last month's conversation about the transformative power of therapy. So for those of you who may not know, I'm also in therapy. So I see that all the time. There's nothing to be shy about when it comes to going for therapy. I go for therapy from time to time, because first of all, it's what we are supposed to do as psychologists and therapists. We are required actually to have our own therapist, because our work we touch on a lot of gray areas. It's not so it's not like, oh, do you have headache? Are you dizzy? Do you have abdominal pain? Describe it to me. Okay, take medication and go. That's not our work. We touch on so many things, and as psychologists and therapists, we need to be grounded. We need to know ourselves well enough. We need to understand what we are going through, because we also have a regular life, So we also go through the brands of stress and stuff like that. So largely we are required to stay in therapy or go for therapy from time to time, so that we are aware of ourselves and know how our present situation may be impacting the interventions that we are trying to give to people. So that is how transformative therapy could be. So have a transformative mindset. If you want to maximize your therapy session, go in with an expectation to be transformed. And having been in practice for a while, I've seen to how much therapy transforms people. So it's interesting. Someone came to me a few weeks ago, and she says to me, "Oh, I don't think therapy works. I don't think if it does, I don't think it works for me. It will work for me. I mean, so someone will ask, so why did you come? Why did you show up for therapy then? Okay, so this person was just invited. Someone just thought that, hey, I think you should talk to a therapist about a few things. Just go and talk. Okay, and so this person came and then it told me, oh, I don't think therapy works. I don't think what I'm even doing right now will be any useful. And then 4 weeks down the line or 4 sessions down the line, the same person tells me, oh, goodness, I should have come in, months before now. Okay, so that's how transformative therapy is. And once we have a mind to be transformed, so in our first session, this is what I did with the person. So the person, yes, you've had your own experiences with other therapists and stuff like that, and so and then also because of what you are going through, you may not think that there's any way out of this. And so it's normal, it's justified, whatever thoughts you have about therapy. But the point is that um, just decide that at least you give this a try, and then you would see how it transforms your life. And so she said, okay, great, we are going to do that. So she assured me that she'll give this a try and then observe how transformative it is. And so, mind you, just by admitting or agreeing to give it a try, she had a mindset to be transformed by the sessions she was going to have. And then we started. And then when we started, after 4 sessions, she came back with a yay. I think I was wrong from the onset. So have a desire to be transformed, but don't look out for big leaps. The way, again, therapy is not like medication. So okay, I have headache, I take a pain medication, and then maybe in a matter of 5-10 minutes, my headache is gone. Therapy doesn't transform like that. Therapy transforms gradually. So have a long-term view in mind that at the end of whatever amount of therapy sessions I'm going to get, this is how I wish or I desire to be after these sessions. But then week on week, as I go in for my therapy, whether it's week on week or once every 2 weeks or once a month, whatever the schedule is, uh, have a mindset to see some transformation in yourself after each therapy session, and be willing to allow yourself go through that experience. I'm emphasizing this one because some people come to therapy and they don't benefit from it. They're unable to maximize the whole therapy session because they have something in their mind and they want to do what they want to do. If you come in for therapy with the mindset of doing what you want to do, on the most part, you won't benefit from it. But if you come in with a mindset of being transformed after each session, one step at a time, you are more likely to benefit from therapy. So again, try and set realistic goals with your therapist or with your psychologist, whoever the person may be. So when I say realistic goals, so someone will say that, okay, but me, I want to start therapy with you, and so I want you to help me with my with anxiety. Maybe I feel anxious most of the time. I want you to help me with anxiety, and my goal is that I don't want to feel anxious at all when I have to talk in front of 1,000 people. That's very unrealistic. That's highly unrealistic. So. Uh, Feeling anxious is normal, particularly when you have to do something quite new to you, or you have to address a group of people, I mean, large crowd kind of thing. So sometimes you will feel you have a little cold feet, but that's supposed to be normal. So if you say that, oh, I don't want to feel that way at all, that'll be an over a higher. I mean, if there's anything like over expectation, maybe that will be it. So usually try and discuss your expectations with your therapist or your counselor, psychologist, whoever the person may be. Try and discuss your expectations with a person so that you can situate it within the number of sessions you are going to have to enjoy, or you situate it within if you are working with a diagnosis, you situate it within the diagnosis so that the therapist tells you that, okay, your expectation is super bad within this diagnosis, and we may not be able to achieve this and that. So I think we can narrow it down to this, or reorganize and look at this particular one for now. So discuss your expectations with your therapist, and be willing to transform, be willing to experience that change, and look back at yourself and go like, whoa, is that me? Okay, so be willing, have that desire, and then it will drive the therapy sessions. Great. So on that note, I want us to consider the next point, which will go a bit deeper into what to do to get that transformation. Okay, so the first thing is make an effort, be open-minded. So I've found that a lot of people sometimes also come into therapy because therapy is largely conversational, it's talk. People sometimes come in with the whole, I'm going to share my thoughts, I'm going to vent, and those are absolutely great and normal. But some others also come in with, I want this doctor to know how intelligent I am. The therapy space or therapy room is not a place for uh, showing intellectual prowess. Once you have that mind, oh, I want him to know that I'm on top of my game, I can handle myself, kind of thing, you may not benefit from therapy. So be open-minded when once you desire or you decide to seek therapy, or even if you are in therapy, be open to opinions. Tell yourself that I will make an effort to embrace the opinion of the therapist. So who is a therapist in the therapeutic process, or in the seeking of psychological help? Who is the therapist? Just to give you an idea, the therapist is the person who will look at things far differently from how you see things. A therapist will help you see things from that brother's perspective, that sister's perspective, that teacher's perspective, that wife or husband or spouse perspective. A therapist will help you see things from your boss's perspective. So a therapist is not there to just listen. We are typically trained to take on or assume other people's frame of reference. So in the grand scheme of things, you would have your therapist point things out to you, or bring your awareness to things that may look like, hey, are you really listening to me, or you want to justify what my mom did the last time? So but the therapist is not there to do your bidding. The therapist is there to help you see things from different perspectives. So um, in our quest to be transformed by therapy, we need to be ready for opinion. Okay, again, once we are seeking therapy, anybody who is seeking therapy will have a perception about things, may have a belief about things, may have an orientation to life based on how you were raised, who raised you, and then your the way you were socialized, whatever the situation might be. There's something that has formed you the way you are, or and the place of the therapist is to help you see things a bit differently from how you've been oriented. So be open. And then also, mind you, therapy is also for shift in perspective. So if you are not open, if you are not willing to hear different opinion and consider things from another person's perspective, you are likely to remain stuck in your own perspective, and that could keep perpetuating what is happening to you. So be open for ideas, be open to opinions, be psychologically flexible. Again, as psychologists, we are trained to see these things. So in the grand scheme of things, you find that once you're finding it difficult um, to accept a perspective, the therapist at some point will call you out on that one. So I've had to do that so many times in my works. I've had patients who come in, they express whatever they are going through and stuff, and as they keep expressing themselves, they are I mean unhappiness about one thing or another, or their experiences in the past and stuff like that, you find that they don't want you to touch it. They don't want you to touch that whatever they're expressing. And as the therapist, you know that you need to touch it so that this person can be can can come out of that experience. And so if when I notice that I need to touch that particular thing, I will, and I notice there's some form of resistance to my intervention or the whole thing, I call my patients out. So if you go for therapy and your therapist calls you out on something, that hey, I realize that whenever we need to talk about this particular thing, you always say, I don't want to talk about it. I don't want to talk about it. I want to keep this as it is. Don't be offended. That is the job of a therapist. It's supposed to bring your awareness to certain aspects of your life you don't want to get into, and then gently and skillfully help you come out of it. So it's not as if a therapist is also going to say something like, um, no, you need to talk about it. No, we don't do that. We only bring your awareness to it and help you come to that place where you can comfortably and conveniently talk about it. So if it ever so happens in your therapy session that your therapist calls you out and says, okay, I realize that when it comes to this and that, you are quite short, you quickly move on from this subject, you want to talk about this particular subject, or maybe a therapist is trying to give you a perspective to something and go like, no, 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 let's not talk about this one kind of thing. Remember that no matter, even if you feel offended, that is the job of a therapist. So we can keep that in mind if we want to maximize our, our therapy sessions. Um, the next one, the next thing you could do to maximize your therapy session is to be keen on learning. Okay, so therapy is largely a learning experience. For those who may not know, therapy is purely a learning experience. If I say it's a learning experience, you see the lady sitting right there on your screen, that picture there, she's learning as it were. So therapy is supposed to be engaging such that you're able to learn from the experience. So in therapy, we do something like we give reading assignments in therapy. So in my case, as a psychologist, and because I have the privilege of diagnosing, mostly what I do is that I don't tell my patients their diagnosis. That's what I do. I will give them what I think may be going on with them, and then what other things could possibly be going on with them. So they go and read. So sometimes by reading, the patient comes to know that, oh, okay, I read on this, I read on that, I read on that, but this one seemed to describe me a bit more, a bit more clearly and completely like the other ones. So my approach is we agree on the diagnosis, but before that happens, you would find that myself and my patients read a lot. So therapy is a place for learning, particularly because, like I said, 6 out of 10 of the time, it's going to be conversational. It's going to be information sharing. And so once we are sharing information, it means that we are learning from each other. As a psychologist or as a therapist, I may be learning from you just to know you more. And then as the client, you will be learning from me so you understand what is going on with you. And then so you can gather all the resources you need to be able to overcome whatever may have been may be confronting you. So be keen on learning. Again, you'll be given homework. So sometimes we tell our patients, there's a patient of mine that I give homework. I told her, hey, you need to do your daily work, okay? Because as part of her therapy, her intervention, she needed to do what we call mindful walking. So I told her, you write down the day you are going to do your mindful walking. You write the time you're going out. You write how long you spent out there. You write about the experience you had, and then when you come in next week, you talk to me about it. That is how therapy can be. It's a learning experience. And so if you if let's if you want to maximize your therapy session, don't go in with the mindset that your doctor or your therapist, your psychologist, whoever it is, will be doing the work for you. No, it doesn't work like that. We do the work together. In the area of mental health, I always say that psychologists and psychiatrists are like surgeons and surgeon and a physician. The psychologist here is the surgeon. So typically, a physician will give you a medication, and then it tells you to take it once, twice daily, or 3 times daily, or once in every 2 days, whatever. And so that is your homework from a physician's standpoint. And then in our case, a surgeon, or the most part, medical surgeon, is more likely to put you on a table and then do a procedure for you, which does not require your involvement. But in therapy or in mental health surgery, you are keenly awake and you are keenly involved in the process. So go into therapy with a strong desire to learn, and always, 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 when you are leaving your therapist or the therapy room, write down something you learned that you were able to learn that day. It's crucial. And so one thing I always do is I have a paper on my desk, and then before my patients leave, I tell them, oh, I need to write you your medication. And then they go like, hey, really, medication? We didn't talk about that. And then I tell them that, well, in my office, the patient writes his or her own medication. So I hand the people over to the patient and I tell you, what have you gathered today? And the patient then writes whatever he's gathered. Sometimes the patient will write, okay, I've learned this about myself, I've discovered this about myself. Okay, I didn't know this is how my my mom or my boss is. This is the personality of my boss. So I've realized how to work around this person. So it's a pure learning experience. And if your therapist doesn't give you papers to write like I do, you could request for that, or you do what I'm going to talk about next. So go into therapy with a mindset to learn and to learn every day. Go into therapy with a mindset to learn every day. Every therapy session must teach you something. And that is one of the ways to maximize. So the next thing is, so let me talk a bit about the learning part, and then maybe we can move on. So have a book for therapy. If you're going to maximize your therapy session, have a book for therapy. And this is my new order. So I told my patients, hey, you need to get a therapy book. And for those of you who don't like keeping books like myself, because I don't like papers, have a notepad or have a portion on your phone, the notepad of your phone where you keep your therapy notes, and then preserve it. What makes that important? Because once you are learning, you must have notes to refer to. It's the same thing like going to see a physician who writes you a prescription or write medication and put the number of times you should take it on the box or whatever the container is. So make sure you are keeping a therapy book and use that therapy book as your mirror. Go back to it, keep looking at it. Who was I before therapy? What is therapy telling me now about myself? And then how do I embrace this new person I'm becoming? So that is how transformative therapy is. So funny enough, all my patients who write their own prescriptions, as it were, or who write what they learned from therapy, I see significant improvement or transformation over the period of our intervention. So let me share one interesting one with you. So about 2 3 weeks ago, I was seeing a very young lady, and she came in with um, a very complex presentation of her condition, and she had been to many places, and it wasn't working for her. So just when she came, I did my usual conversation. I told her, hey, this is going to be a learning experience for you. So you need to bring your book along whenever you are coming, and then we'll be able to work together. Mind you, this lady's condition um, is a very severe one. Just when she brought in her book and we started writing, she was able to track her thought pattern. Before then, she would sometimes hear voices. She would sometimes see things which are not there. And I'm working together with a psychiatrist, and on the most part, when she's hearing voices and all those kinds of things, the psychiatrist is more likely to increase the dosage of the medication to help her to help reduce the thoughts or the voices she's hearing or things she's seeing which are not really there. But just when she started bringing a therapy book and it's structured, I try to keep it structured for patients like that. So structured such that she's able to track her thoughts. Believe you me, after that 4 weeks of seeing her, she doesn't hear voices again. Then we were able to realize whatever she was calling voices were not really voices. And whatever she was seeing were not really what we will call visual hallucinations. So then I go back to talk to her psychiatrist and say, hey, I think this lady has been misdiagnosed because the intervention is working. She's not seeing voices. She's not hearing voices anymore. She's not seeing things because she's tracking her thoughts and she's able to gain control over it. And because she's learned the skill to do that. And then now we've decided to reduce the medication. Back then, it will be dosage increase uh, every other time. But now, because she has control over her thoughts, she's able to go back and say, no, I heard this thing, and no, this is not a voice, this is a thought. And if it's a thought, this is how to handle it. She's been able to gain control over herself, and now she doesn't have to be on that medication, at least to that the level of dosage she was on. So I just want you to know that keeping a book in therapy is extremely important in maximizing your therapy session. So the next thing is that sometimes in therapy, um, people are quite apprehensive about asking questions. So most people will come with therapy, okay, oh, I want us to talk about this and that today and stuff like that. And then they get up and leave after the whole intervention. So when my wife was pregnant, one thing I told her was that or we agreed on was that before you go for antenatal, write all your questions down, because your antenatal is typically sometimes once in a month, until when you are getting close to delivery, then it's once every 2 weeks. And then when you are very, very close to delivery, it's once a week and stuff like that. But the once in a month means that a lot will be happening to her. And when it is time for her to go and see her doctor, should the doctor ask her, okay, what has been going on? She might not be able to tell the doctor what has been going on with her because she couldn't keep track of it. And the beautiful thing is that once she started documenting, she sits in front of the doctor, and then she has a list of questions. So I experienced this. What is that? I experienced this. What is that? Doctor explains everything. She leaves the doctor's consultation room with a clear mind that actually there's nothing wrong or nothing going on with her. The doctor is also happy that the patient has been able to ask all possible questions which could alleviate or prevent any form of complications in the future. The next thing is that it reduces the consultation time. So she goes to sit in front of the doctor, and it's not, oh, okay, let me think. Oh, maybe, okay, no. When we do that, you confuse the doctor, and he might be tempted to do something he's not supposed to do for you. So always make sure that you have your bag of questions before you go for therapy. If once you are in therapy, if anything happens to you that you think should come up in your therapy sessions, make sure you write it down, and don't hesitate to ask your therapist questions. And again, it's amazing how some of my patients do it. I have a patient who will come in with a list of questions. So she'll say, Dr. Queen, today I want us to talk about this and that and that. What do you about today, because we are working on a treatment path. And then I tell her what I think we could talk about today. Then we decide on which one is weightier, because we have just about 45 minutes to an hour to talk about. So we need to pick which one is weightier for the moment or at the time. And then when we pick it, she will say that, okay, before we go into this, I want you to know that I have 5 questions for you. So let's talk about this. But in the last 7 minutes or 10 minutes of my sessions, I want to ask you these specific questions. And the amazing thing is that by the time we are done with that 40 minutes into the 50th minute of her sessions, we would have answered half of her written questions. And you see, when patients approach or clients approach therapy like that, they get the benefit so quickly, because largely it's about what is happening to you and your ability to track it, and then having the needed skill and resources to deal with them. So that is how beautiful it could be when you come in with your list of questions without feeling, oh, hey, if you can he answer this question, am I not disturbing him? Is it even necessary to ask this? Go into therapy knowing that it's necessary to ask. You are not disturbing the person because you've probably paid for it. And then even if you haven't paid for it, once the person has agreed to have some form of consultation with you, it's only expedient that questions are answered. And then if for some reason, so one thing some of my patients will do is that one patient of mine, she would typically ask her questions in bits. So she go like, hey, Dr. Me, I don't want to disturb you, but I want to ask you one question. I feel like, oh, come on, go ahead, ask your question. She would ask, I'd explain, we talk about it, and then before she goes, like, okay, I have another one. So it makes me know that she typically will have questions, but she's just, and sometimes it is just what has happened to us, which may be impacting how we flow along those lines. Some of us haven't had the opportunity to question anything in our lives. All our life decisions have been made for us. So when we have to ask questions, we feel we are disturbing the person, we are being a bother to the person. And feel free. And to be honest, on the most part, by the time you start going like, oh, can I ask you a question? Hey, is it okay to ask a question? Your therapist already knows that you have a challenge in that area and may even make a note of it to help you with assertiveness and stuff like that. So when you are challenged, when you don't know whether it's okay to ask a question or not, just simply say this thing. is it okay to ask a question? Or I want to ask you a question. Do you mind? Just say it. And then you soon find that your question is actually going to open the door to your transformation. So that is one significant one. And then we move to the next one, which is I like the next one. I think has to do with consistency. Yeah, consistency. So a lot of people do this. So they come for therapy. If you want to maximize your therapy sessions, be consistent. Be consistent. When I say be consistent, um, treat your therapy sessions like every other important appointment you have. Okay, treat it like every other important appointment you have, and be consistent. So don't do what some people do. Some people show up for therapy and your next appointment is in 2 weeks. Okay, and then 2 weeks comes, they don't show up. Third week they don't show up. Fourth week they are in your office, and then you ask them, "Hey, did you get an appointment?" "Oh, I got an appointment to come and see you today." "Okay, you're supposed to be to be here 2 weeks ago." "Oh, I forgot." "Oh, I didn't feel like coming." We hear that all the time. It's normal. It's normal, and sometimes it gives us an impression of what may be going on with the patient. But then try to be conscious about being consistent with your therapy sessions. Why is this important? Because most of the time, when you are consistent with your therapy session, your therapist is able to help you a bit more because they're able to track your progress. They're able to track aspects of the intervention which needs to be enhanced more. So um you would find that your therapist is on top of his game or her game once you are consistent. Once there's inconsistency, you come back, okay, it's supposed to be here next week, you come back 3 weeks time, you may possibly come back with something. "Oh, this thing happened to me and I thought I should come in and to talk to you about it." Okay, so whatever work you've started doing with your therapist will be shelved, and then the therapist now starts working with you on this new thing you brought up. And sometimes this new thing you are going to introduce to your therapist would have been resolved if you stayed in therapy. So the point is that try to be consistent. And I always applaud some of my patients. I don't know, but I think I have fantastic patients anyway. Because some patients they'll just tell you. Just about a week ago, a patient of mine was traveling, and it was an impromptu travel. She just texted me, "Hey, I can't come in tomorrow. So what do we do about it?" And then I said, "Okay, based on whatever we did the last time, I think you can take the week and then come in when you return. I mean, a week after you've returned from your trips." Like, great. And then once she landed, she was in therapy. So that is fantastic. So it's not as if, I know some of us have challenges with keeping or being accountable to others. Again, that's something we need to work on if you have a challenge being accountable to someone. So try to be consistent. And if you find that for some reason you cannot be consistent, sometimes it is the way you feel. Sometimes you wake up in the morning, particularly those we may be treating for depression. You wake up in the morning and you just don't have the energy to move out of bed. Tell your therapist that, "Hey, I needed to come in last week, but sincerely, I just couldn't get out of bed." That gives your therapist some insight into what may be happening to you. Or, "Oh, I'm traveling." Maybe you're working with your therapist around the issues of stress. And then, okay, last week you traveled, 2 weeks ago you traveled. So your therapist becomes mindful of what is going on with you and then may be able to help you. So if it's within your power, try and be consistent with your therapy sessions. That helps you to maximize the sessions. And then if it so happens that you cannot show up for your therapy sessions, communicate with your therapist. That's if you have the person's contact. Or if you don't have the person's contact, find the means through which you reached this therapist, psychologist, whoever it is, and then communicate through that means that, "Hey, I can't show up, so I'd like to reschedule for this other time." And then the other thing people do is some people don't discuss their exit plan. So when I say exit plan, maybe you've been in therapy for 6 sessions and then suddenly work changes, or you don't have the financial strength anymore, or someone in your life is preventing you from showing up again, whatever it may be, try and discuss that exit plan. Even if you feel you've had enough, like, oh, I think so far so good, I'm doing so well, so I want to step out now. Discuss it with your therapist. And again, don't be worried about discussing your exit plan. Some people feel that, oh, once they tell their therapist, oh, they can't show up anymore, the person may be offended. No, any therapist who gets offended for you exiting possibly may need some form of therapy. Maybe that therapist hasn't been going for his therapy for a while. So try and discuss your exit plan with your therapist. Tell the person that this and this is happening in my life right now, and for this reason, I may not be able to come for therapy. What I typically do for my patients or my clients who cannot continue their therapy is, once they tell me about their exit plan, oh, I'm traveling out of the country in the next 2, 3 weeks or 1 month, so I cannot show up for therapy anymore. We discuss the exit plan. What I typically do is that I talk to the patient about progress made so far. So it's very conversational. Since you came, what has been happening? What have you gained from therapy? Bring up your book. Let's see. So the patient discusses everything. So the patient comes to realize that, oh, indeed, I've achieved a lot. And then if I have something I wish I could do with the patient, I document everything systematically for the patient. So this is what I would have loved for us to touch on. So I itemize what I would have loved for us to touch on. And I give the patient tips to help him or her remain grounded within the period that he or she may not be in therapy for whatever reason. So I say, okay, this is what I wanted to work with you on. But I noticed that because you won't be in therapy, we may not be able to benefit. So I want you to do this and this. When you experience this kind of thing, work around it this way. When you experience that thing, work around it this way. So I give my patient or tips to work around things. And then I keep my door open. So I always tell my patients that, listen, if at any point in time you are going into therapy with someone else and you need me to write a report for you, something to let this new person know what you've done so far, and how this person could help you, I'm always happy to do that. And thankfully, I think a month or two ago, I did that for a client of mine. I mean, she gained admission to a university abroad and she left. And because we discussed the exit plan, once I was there, she just texted me, hey, Dr. Kumi, can you write me a report for my new therapist? He wants to know what you've done with me so far, so he's able to continue. That's great. And I did a very thorough report for her. And when I sent it to her therapist, I thought, oh, great. Because just when the new therapist started having a conversation with her, a few things crossed her mind. But because she wasn't sure, it's her first time seeing this patient of mine, she wanted to explore that. So when I sent the reports to this new therapist, she's like, oh, great, thank you very much. Because after my initial conversation, I thought I would work around that. And then the new therapist is able to, hit the ground running, as it were. So um, these are a few things we could do to maximize our therapy sessions. Make sure that before you remain consistent in your therapy sessions. And if you ever want to stop therapy or change your therapist or whatever may require that you step out of your therapy, and make every effort to discuss it thoroughly with your psychologist, psychiatrist, mental health counselor, whoever it is, and then ensure that the person is in the know to help you get into your new therapy sessions or even exit gently and gracefully. So these are the things I would want us to share today. I hope it's been useful. We'll make some time for questions, I guess. Thank you all for making the time.
Okay. Thank you, Dr. Paul. Wow, this has really been an insightful session. So we want to move straight to our questions for today's session.
So let me talk a bit more about a few observations I've made in my practice and then how we could take advantage of it. Sometimes people ask this question, who is the right person for me? How do I know if this therapist, because you want to maximize your therapy sessions. So people ask this kind of question that, okay, who is the right person for me, or who can I trust? I just want to quickly say that it's very difficult determining who the right person may be for you or for anybody who wants to go into therapy at some point. Reason is that some therapists are very, very unassuming. Okay, so some people are looking for that. You're looking for a certain appearance to know that, oh, this person will be great and stuff like that. I just want you to keep your door open. Okay, keep it open. The best thing you could do in determining who the best fit for you is, again, let me say this before I continue. Some people also go to social media or to people's website to read their profiles and stuff like that. Well, that's good, but profiles don't really give insight into skill. Okay, people can really write very beautiful profiles and may not be able to deliver it in terms of the interventions. Okay, so the general thing I'd want to advise is that, first of all, make sure your therapist is licensed. And you can for every institution, if your therapist or whoever you want to consult with works in an institution, you are sure that the person is likely to be licensed, because most institutions will do their due diligence before they enroll someone. So if it's in a hospital setting or something like that, you can be sure that the person is licensed. Now, if it's in a private facility, you have to do your background work, because a lot of people someone will take maybe a month course, 6 weeks course, and still set up a practice, and that can be dangerous. So averagely, for those of you who may not know, it takes a minimum of about 7 to 8 years to train one psychologist. So minimum, that's entry level psychologist. So it tells you the amount of training that goes into one person becoming a psychologist. So definitely someone cannot do a 6 weeks course and call himself a therapist or whatever. On the most part, the person can do some form of guidance or something. I don't know, but that's just for us to know. To be on the safer side, make sure that you do your groundwork. If it's an institution, good to go. If it's not in an institution, it's private practice, online, whatever it is, try and do your groundwork first. What's the best way to do groundwork? So in Ghana, for example, if you want a psychologist, just Google gazetted psychologist. Okay. Once you Google gazetted psychologist, every psychologist who is licensed, you see a list of psychologists who are licensed, and then you'll be able to tell whether the person you are talking to is in that list, or the person you are considering to get into therapy with is in that list. If you don't see that, you may want to, do some extra talking about it. The other one is that in every gazetted list, you'd see that we've been put into categories, because psychology is a specialist field, and there are different types of psychologists. So there are clinical psychologists. I'm sure in my profile you see that I'm a clinical health psychologist. One day we'll talk about all those details. And then there are health psychologists and mental health counselors and stuff like that. So make an effort to look out for who will best fit you in terms of what you are going through. If you look at the category, you'll be able to tell, okay, this person is a clinical psychologist or a clinical health psychologist. There's a difference. They can read on it and know what the difference is, and then you could work with that person. The other one is that within the same field, so one patient says to me, he called me, and that for me was good, even though at some point it was too much for me, admittedly. But the patient calls me and tells me, okay, are you so so and so? I'm like, yeah, I'm so so and so. And then he says that I want you to tell me what you can do for me. So the patient starts asking me, which school did you attend? What courses have you that I know a lot of people will find that annoying, but that's a patient trying to do his due diligence. The good thing about this particular patient is that he's been seen by almost 6, 7 different psychologists. So he knows that you need to try and do your groundwork to know whether the person can help you or not. So it's very important to do some form of due diligence. Thankfully, those of us on this call or in this conversation, if you ever want to go into therapy and you need my opinion on it, okay, I've seen this person, or I've heard about this person, and what's your thoughts on it? I'm open. I'll be willing to give you candid my candid opinion on it. But then try and do your groundwork to be sure the person is licensed within a certain category of the psychology profession. Then you can comfortably go into therapy. And yeah, so that's one of the things about finding your best fit. Some people are also keen on should I go into therapy with a male or female or stuff like that. Well, those are gray areas, and I typically would say that focus more on the help you can get than on these other ones, the gender of the person and stuff like that. Sometimes the truth is that who the person is could help. If the person is a male, female, or elderly, younger, it could help. But one interesting thing I have come to find, and it's totally mind blowing, is that I've seen very young psychologists do exceptionally well, sometimes better than very old psychologists. And the reason is that some young psychologists may have been practicing consistently compared to an older person who maybe is doing some form of teaching or has some business and does therapy on the side. It's not the same, really. That's not to discredit any older psychologists because they also have, I mean, I know some wonderful older psychologists. So I just want you to know that when you find the person with the skill, go in and then try to get the help you need. If you get in and you find that you don't like the style of the person, because there's, like I said, clinical practice like surgery, it's style. The nature of the person, the orientation of the person, the style of the person could also influence the outcomes. So if you don't like the style of the person, you could step out. Of course, like I said, discuss your exit plan. So just tell the person, um, I think that this style is not working for me. So I would want to consider someone else. Some of us don't like confrontation. So we will just exit quietly. I don't recommend that. I think it's best to give feedback. So if you don't like the style of the person, you can step out. Sometimes you go in and then after your first 2 sessions, you go like, whoa, this is exactly what I want, irrespective of whatever the person's background or whatever may be. So this is also something to share. I realize that we don't have any questions today. Right? There's one question. Okay. So I was almost about to.
Yeah, so I think I'll start with the question. So this question is, what do I do when my psychologist interventions are not working on me?
Whoa, that's an interesting one. Okay. I just want you to know that in the coming weeks, we'll talk about different types of interventions, but always discuss what the intervention is targeted at. I have found that sometimes there's a disparity between what the client thinks the intervention should do and what the therapist may be doing. So always agree on the intervention. Okay, so one example will be that you tell a therapist that I can't sleep and I have a lot of headaches. Sometimes I feel afraid, especially when the day has been stressful. I just begin to feel jittery and quite anxious um, unexpectedly. So, what should I do? And then your therapist decides to do a procedure for you. Meanwhile, your expectation is that the therapist should talk to you about what you're experiencing and try to give you tips. At that point, you guys are in different worlds. So when the therapist tries to do a procedure for you, understand what the procedure is. Ask the person, okay, you want to do this for me because I said that and that, right? Yes. What do you seek to gain by doing this particular thing? Okay, then the therapist will just explain to you that, okay, this intervention is supposed to do this, that for you. And then once I achieve this, we can now talk about this based on what you said. That gives you meaning. So if you have to do the procedure for 2, 3 weeks before you guys get into the other things, you soon find that that was useful to you. So always make sure that you and your therapist understand what is going on. Whatever a therapist is doing for you, ask the person, what do you seek to gain by doing this? And then when the person explains to you and it makes sense to you, you soon find that it begins to, the intervention becomes a bit more meaningful to you. So don't discount the interventions if until you have engaged your therapist. Don't discount the intervention. Ask your questions, and then if you feel that still whatever the therapist is doing is not useful, you can talk to the person about other meaningful approaches. And that said, I just want to quickly say that not all psychologists or therapists have training into certain types of procedure. So if the therapist doesn't have training into a certain type of procedure, particularly the license, they will tell you that, okay, I don't have training in this area, so I could refer you to somebody who can do this procedure for you, and then I hope it works for you. Then you possibly move on to a new person. But then if the person doesn't knows how to do the procedure and you talk to the person, he or she might consider it. I've had a patient do that. A patient asked me, can you do, there's a particular procedure, I don't want to mention it. Can you do this particular procedure? I said, yes, I can do this procedure. Why do you ask? Patient said, oh, I read on the internet and I'm told that it is the best procedure for what I'm going through. And I was like, oh, great. But okay, there's this other procedure and that's other intervention as well. So I explained the interventions to the person. And then I told the person that based on what you're experiencing, that procedure will not really work for you. This one will rather do the trick. So let's start with it and see if we can make some progress. Thankfully, when we started with what I had in mind, he saw the progress and then he was happy about it. So I hope this is useful.
Thank you, Dr. Paul. There's one more question. So, is therapy expensive? Since we are talking about maximizing our therapy session, is therapy expensive?
Is therapy expensive? It's actually relative, to be honest. Could be expensive. The whole word expensive in terms of money is a very relative thing because depending on your financial position, you may have to pay a certain X amount of money for therapy, and that may be expensive to you, but it might also be insignificant in someone's pocket. So I won't I won't say therapy is expensive. I'll say that it is well priced depending on who you are seeing. I think it's typically well priced. And then as therapists or as psychologists, we also train um, to do work with what we call sliding scale. So some psychologists have different prices for different people, and then they also have different prices for different interventions depending on the duration or the intensity, whatever it may be. So once you need therapy, talk to your psychologist, whoever you want to work with. Let the person know what your budget is, and then you can strike some balance, and I'm sure you benefit from it. So always be open about your finance because therapy can span a while. So be open about your financial situation and let the person know that, hey, I want to do therapy. You said this is what is going on with me, and always do your first consultation anyway and get to know what's going on with you. So after that, you can have a conversation. Okay, you said I need to do 6 sessions, 12 sessions, whatever. But if I look at my finances, given my initial payment, I don't think I can bear that cost. So can we work around it? And then your therapist will sit with you and do some mathematics with you, and you'll be able to work around it. That's what I typically do. So I can't really say whether it's expensive or not. Open up about your financial situation, know how many sessions you possibly will need, and then discuss how you could conveniently sustain your sessions. And once your therapist is in to help you and then to also do business because he needs to feed his family or her family, you may be able to make some headway. I hope this one is also useful.
Yes, that's very useful. We want to take one other question. The question is, how do I know whether I need therapy?
How do I know if I need therapy? First of all, at any point in time in your life, you possibly will need therapy because of one thing or another going on. But the point where you go in to see a therapist or you look out or you try to ask for a therapist is when you notice that you are challenged in handling a particular situation in your life. How will you know whether or not you are challenged in handling a situation in your life? Any situation that makes you stay up at night, okay, you have to brood over it night on night or day after day, it means that you need to talk to a therapist about it. So that's one of the ways you can tell whether you need to see a therapist or not. Any situation that prevents you from having restful sleep. So apart from brooding, sometimes you find that you cannot sleep well because of something that is going on. You need to see a psychologist or a therapist about it. If you find that you are not in control of your mood, you always have to, for some reason, either apologize for your mood because of the way you felt, you acted in a certain way, or people draw your attention to a particular response pattern that, hey, I think you sound very cheeky, or I think you don't, you always give me the impression that you don't want anybody around you. When people begin to pass comments which suggest that interacting with you is a bit difficult, you need to go for therapy because interaction, the x-ray to our souls, I'm sure most of us know x-ray. The x-ray to our souls is our our our, our, our words and our behavior. So if you want to know what is going on with you, check what you say and what you do. You have a pure idea what is going on with you. So when people begin to draw your attention to, oh, nowadays, I don't think you are okay. You are the same. You are not the person I used to know. It is time for you to go for therapy. When you notice that you are experiencing medical conditions which are not being picked up by the labs that are being done. So you have headache, you go, they treat you, you come back, it returns. You have infections, they go, you treat, it comes back. You have malaria, you go and test for malaria, and then it's negative. You start some malaria medications, and then 2, 3 weeks again, malaria is back. I'm talking about malaria symptoms. It's a sign that something is going on with your mental health and you need to seek help. There are also times that someone will have to bring your awareness to it, particularly if the person knows you very well. The person is likely to tell you that, I don't know what is going on with you, but I think you should talk to someone. If you've ever heard this thing or you are hearing this thing now, I don't know what is going on with you, but I think you should talk to someone. Please and please again, try and seek therapy. It is time for you to seek therapy. Apart from this, I know there are the pure psychiatric situations where somebody loses awareness of themselves. Okay. And when you lose awareness of yourself, you can also seek therapy. And then finally, if you have to make any life-changing decision that you are conflicted about, like you want to make a life-changing decision. When I say a life-changing decision, it's a decision which could change the course of your life. It could be a marriage decision, a job decision, travel decision, whatever. Anything that could change the course of your life. And you are torn, you are not sure what to do. It's not clear to you whether you really want to do this or not. It is time for you to talk to a therapist. On the most part, they will be able to situate what is happening to you properly and then you'll be able to scale that experience. I hope this one is also useful.
Thank you so much, Dr. Paul. Last question we want to take. Looking at the cultural understanding and stigma of going to see a psychologist, how do I tell someone to seek psychological intervention to their problem without sounding offensive?
Hmm. It's a brilliant one. Okay, so mostly it could sound offensive, and I like the fact that the question is situated within culture. Okay, so what you do, so if the person is someone you could get close to the person, and then tell the person what you've observed without trying to be prescriptive about it. So don't go in telling the person, I've noticed you don't talk to me, you don't do this, so you have to talk to me. No, you don't do that. You could simply couch it like this: I've seen some changes in you. I can't put my finger to why there's this change or what is going on with you, but I think it will be good for you to talk to someone about it. Now, mind you, by saying this, what you've said is that you are not trying to diagnose the person, you are not trying to prescribe what the person should do. You are only bringing the person's awareness to a change, and without mentioning what the change is, so that you seem to sound like some authority figure in the person's life. You mentioning that you've seen a change, and then you think, so always be suggestive. You think that it will be good for the person to seek help. Then you add the additional component. You tell the person that you are willing to support him or her to get the needed help if you can. So what that means is that you tell the person, if you want to talk to any psychologist, I know this institution or I know this psychologist who may be able to help you. I'd like to either connect you with the person by passing the person's number on to you, so you call, or the institution's number on to you, so you call, or I could do an initial conversation with the person for you, and then you can go in and then seek your help, the help that you need. Also be open, because once you start talking about someone's mental health, you should be open to support the person at least to get the help. So that's not to say you are going to fund it. If you have the means to fund an initial session, it will be great for you to do that. But if you don't have the means to fund it, you also open up that if the person needs you to go with him or her for the first consult, not to sit in, but just to keep the person company, you're also available. But if the person wants to go on their own, it's also perfect. So first of all, try not to be prescriptive about it. Tell the person what you know or what the person should do. Try not to determine what is going on with the person. Try not to, be specific about what is going on with the person. Third one, make yourself available to support the person. And if you can, facilitate the process for the person. I'm sure once you're able to do this, the person will know that you are not trying to say there's something wrong with him or her. Thank you very much.
Thank you so much, Dr. Paul. Over to you, Dr. Paul, if you have any last words for us.
Okay, thank you very much. So I'm happy to do this, and I'm so happy that we all made time to join. Like it's been said there, and I want to re-echo that we are doing this strictly because there are only a few psychologists in the country, and we realize that there's so much need for mental health care, and information has always been scanty. We don't really talk about mental. That's why we are doing this. So you know anybody who needs to join this, or you have any suggestions how to reach out to many other people, feel free to share it with us. And then let's keep getting people on board. And if you know anybody who, for some reason, needs our help, feel free to reach out to us, and then we'll be willing to support whichever way we can. Thank you very much. So if you want to reach out to us, I think that you could use the emails, and I'm sure in due course we may give out a number which will make it a bit more seamless. Thank you very much for making time. We appreciate it so much.